Happy Sunday. It is July the 22nd. Thank you for joining in for another episode of the Nurse Doc Show. Tonight, we're going to be talking about something that really shocked me. It's when I talked to my good friend Sunil, I was speechless. So I am so excited to share this information with you guys. I hope it's coming over clear. Sorry for the late start. Check out the promo and we'll come back and we got a lot to talk about tonight in 30 minutes. All right? Bye. So yes, we are back. Ian, thank you for the comment. Yes, it is back-to-back podcast tonight for me. For those who don't know, I will be on at 9 o'clock Eastern time with my homeboy Mike, the nurse doc. He's not the nurse doc. Mike, we will be on the American Association of Men in Nursing, an incredible organization that is working on increasing visibility and workforce for men to enter the field of nursing. So I'm looking forward to that. Hopefully, we will be able to have it live. It is part of a closed group, and tomorrow it will be live and everybody can see it. All right. So tonight we're going to be talking with Sunil Wadhwa. He is from a incredible organization that is out of New Jersey, and they have several offices all over. So, I mean, I wrote down a bit of something. So, if you're taking medications, then you will absolutely not want to miss today's show. Today, we are discussing the fourth leading cause of death in the US: adverse drug reactions. Based on your body's genetic makeup, you might be taking the wrong prescribed medication. I mean, I don't know about you, but I take medications. I have family who take medications. It's one of those inevitable things that in life you will be doing, even if you don't want to do it. It's just an unfortunate part of life. So he's going to be on, and we're going to be talking about it. But first, I want to talk about thanks so much again for your support. Over the last week, we had like 2,600 video views and still going up. So thank you all for continuing to support me and definitely pay attention to the content that I'm trying to put out. Last week, Jacques was on, and I mean, it was an incredibly interesting show, one that was new for me. For those who don't know me, I'm a relatively private person, especially when it comes to conversations about family. But one of the things that I think is important is that you kind of have to swallow your own medicine. And as a psychotherapist, I'm constantly pushing my patients to be comfortable with having conversations about sensitive topics. And if I can't do the same myself, then I felt that I'm doing a disservice and, at the most part, kind of trifling. So, yeah. So, Sunil is going to come on. This is a picture. You can take a look at him. Um, and I took off the Instagram because y'all could check me out on Instagram as the Nurse Doc. So Sunil is the founder of Medics Prime. He's a visionary. It's a visionary company that's used to save lives about adverse drug reactions. So we're gonna bring him in. All right, Sunil, are you on?
Sir, I am.
Thank you. I don't have a lot of monitors sometimes to see everything that's going out. So thank you for holding. Thank you, thank you, thank you.
Great to
So
be here, man. Thanks for having me.
you're welcome. You're welcome. So you really educated me a lot, which is why I asked you to come on the show and share the information that you shared with me because I'm astounded. And then as I've done more thinking and digging into my work, I kind of realized that it made a lot of sense. And I really appreciate that, especially considering the fact that you're not a physician, uh, and not being a physician, but you're still so passionate about genetics. Tell us how you got involved in that and what kind of like drew this into like your foresight.
Hey, man, it was totally by accident how I ran into this brilliant test that we're going to talk about tonight. It's absolutely astonishing that most of the population has no clue.
Hmm.
I venture to say probably 99.999% of your audience listening today have no clue the seriousness of adverse drug reactions, which, as you said, is now the fourth leading cause of death. The fourth, man, the fourth. We're not talking about 400, the fourth leading cause of death. What is even more astonishing is the fact that the medical community equally doesn't know a thing about this brilliant test that we want to drill down on today. I'm very passionate about this topic because I almost lost my wife 10 years ago due to an adverse drug reaction. And my father had an open heart surgery. And as we all know, the myriad of medications that an open heart patient is put on, and the poor guy had nothing but reactions. It's an interesting story how I actually ran into it and why we started our company 5 years ago. But I don't want to jump too far ahead here. Maybe we'll come back to that.
Hmm. Okay. Uh, Thanks, Ian, by the way, for letting me know that I'm off center. So hopefully everybody can see me. Appreciate that, buddy. That's one of my American Association of Men and Nursing members, by the way, guys. So sorry for going off onto a tangent
You're
before.
good.
So I was astounded to learn that drug reactions are the fourth leading cause of death. And one of the things that we've always known, actually, now that I think about it, in the medical community, there was this publication, and some of you all can probably correct me. About 20 years ago, we had a huge study that over 1 million people that come into the hospital, possibly more than that, or maybe a little bit less than that, were being affected by the medications that we were giving them. Whether that be medication mistakes, whether that be the wrong medication being prescribed to the
Yeah.
wrong kind of patient. And so now that you bring this kind of full circle for me and having the conversation about what does that happen, how does that happen for people who's outside in the community because they don't have a nurse who's in front of them 24 hours a day, 7 days a week, monitoring the possibility of an adverse drug reaction or being the prescribed the wrong medication. So thank you. And although it's pretty self explanatory for the audience's clear understanding in layman's terms, please describe the adverse and what adverse drug reactions are.
Yeah, thanks for asking that question because it's really amazing to me as we talk to people all over the country. We all watch those crazy TV commercials all the time, don't we? We see those
Right.
commercials where they talk about the medication for about 10 seconds and the rest of the 2 minutes is all about what can happen to you, right?
Hmm.
And but in layman's terms, man, or actually by definition, what an adverse drug reaction is simply an unexpected dangerous response to a medication. Okay. And in real layman's terms here, look, man, you and I and everybody, we're different, obviously, right? Our
Hmm.
bodies, our genetic makeup, our metabolism is totally different. And despite having a nurse or a doctor watching us, there's no way that anybody can see inside our body. So, granted, we want to try to keep an eye on patients, but there is really no way to know for sure without this brilliant test that we're going to talk about.
Okay, so the statistics that you shared with me are staggering. What's the story behind the numbers?
Mind-boggling. In the United States, there are 4 billion. That's with a B, man. 4 billion prescriptions written in this country. What's the population of the U.S.?
You got me.
Sorry, man, not to put you on the spot. It's around 330 million. All right, 330 million. All right, so guys, let's do some quick little math here. We got 330 million people in the United States, and fortunately, there's a few left, I think, that don't take meds. Right? Fortunately, so Wesley, you okay with calling it, say, 250 million that take meds?
Yeah.
That'd be a fair number. As
Perfectly.
probably a low number, but just be conservative here, right? So,
Being
but here's
conservative.
my point. You take 250 million people that are consuming 4 billion prescriptions. Do your math on that, man. What the point I'm making here is that just about all of us are on meds, and of course on multiple meds. And let me share a stat that's going to really, I hope, really wake up your audience today, because this is such a serious topic and is not being talked about. We're talking about the 4th leading cause of death. 2 million of us are going to be hospitalized this year because we had a reaction to medication. Now, you read out a number that was, back, I think you mentioned 20 years ago, but today, today it's 2 million of us are going to be hospitalized because we took a medication or a combination of medications, didn't suit our body, and we end up in the hospital. Okay? Now, here's a more serious number, man. 125,000 of us are going to die this year because we took a medication or a combination of meds, didn't suit our body, and we didn't even make it to the hospital. Or even if we made it to the hospital, we're still going to die because it affected our body that much. 120, and look, man, numbers go in and out most people's ears. And so let me give an analogy to really make sure your audience understands the significance and importance of what we're talking about here today.
Perfect.
125,000 deaths a year is like an airplane.
Okay. Going
down every day, man, with 350 passengers. Every single day, an airplane crashing in this country. Every single day for the next 12 months equals 125,000 people. Wow. All right? Wow. That's a big number. Big number. And no one's talking about the seriousness of adverse drug reactions. And more importantly, no one's talking about what we're going to talk about, and that is a solution, a simple solution that nobody knows about, including, again, even the medical community doesn't know about it.
Right. I didn't know about it until we had the conversation. I mean, I knew about drug reactions, but never to this extent. So I'm glad that you were a visionary and you started this company. And I just want to digress for a second because you're obviously passionate about this. And you said about your wife passing or having an adverse drug reaction.
Right.
What led to you even starting such a company and being a visionary? Because again, not a lot of people even know about it, think about it, or even want to actually know about it.
Yeah, that's a great story, man. And I love sharing this because I was actually coming back from New York. Our 21-year-old just had a birthday, turning 21. And she invited mom and dad to go out to New York and hang out with her and party. And so we said, you want the old people to go out with you to New York? And so we went out to New York, man. We partied for a week with her. And on the way back to California, our corporate office is in Northern California. So on the way back to California, I'm reading an article, bored in flight, just flipping through articles. And I ran across information about this test. And I'm reading this article, man, and I'm getting just fuming mad, because I reflected on what happened to my wife 10 years ago. My wife had a karate accident. I've got 2 daughters and a wife, man, that decided to go get their black belts in karate. Oh, wow. So needless to say, man, I have no say in my home or in my office because they run the joint here too. So, but anyway, that's another story, right? But we're coming back. I'm reading this article, and my wife was testing for her black belt, and long story short, man, she jumped over a student. She landed wrong. Her leg went snap, crackle, and pop. She ended up in surgery, 7 screws and a plate later. The hospital floor that night was on high alert because her breathing got extremely shallow. And the next day, the doctor came in, and to our surprise, frankly, he said that she had a reaction to medication. We didn't know which medication, but she had a reaction to medication. Long story short, when we got into the space, we got her test done, and bottom line is she cannot metabolize morphine properly. And what was she put on? Morphine.
Oh.
Okay.
I thought they would pump it up. Go ahead.
She was put on, exactly. She was put on morphine and she kept hitting the button and she started to have a reaction to it and her breathing got extremely shallow and all the things that adverse drug reactions are all about. And then I continue to read this article, reflecting on what happened to her a number of years before I'm reading this article.
Mm-hmm.
But just 2 years prior to reading this article in Flight, my father had an open heart surgery. And I'm reading this article thinking, why in the world didn't my doctor, my father's physician,
Mm-hmm.
give him this test, man, this 2-minute test that we're going to talk about here before cutting the man open in half? Because after the open heart, of course, he was put on myriad of medications,
Right.
and the poor guy had nothing but reactions. And every time he called the doc, what do you think the doc said, man? I love doctors, but don't get me wrong. I mean, you know, the doctor's response was, "Hey, come on in, and we'll try something else."
Right.
Right?
Exactly.
So off to the doc, he changed the cocktail out. You know, hey, let's take out this med, and we'll add a couple more, and you know. Increase the dosage of this one, decrease the dosage of that one, off to the pharmacy, back home, try that cocktail. That made him worse sometimes, a little better sometimes. Hey, doc, I'm feeling like crap, man. I'm feeling worse than I was before. And same routine, man. This nonsense went on for about a year before they finally figure out the right cocktail.
Wow.
So I'm reflecting on all this, Wesley, in Flight, and I'm just fuming, man. I'm fuming, Matt, thinking, what the heck, man? Why in the world would this test that's been now out, by the way, for 14 years.
Mm-hmm.
Wesley, let me repeat that. The test we're talking about today has been around for 14 years.
Right.
And nobody knows about it.
Right. I mean, I've been in
Okay.
healthcare for 17 and didn't know about
Yes, sir. Yes, sir. I know. And it's sad to say, man. So I got off the plane that day and I called my team and I said, guys, we know nothing about this world, but by golly, we're going to get into this world because we're going to figure out and we're going to expose everybody we can, because everybody in America and frankly everybody in the world needs to know about this test.
Right. And one of the things, like, so you mentioned about your wife being on morphine. Morphine is an opioid, for those who don't know. And this country is in an incredible crisis behind opioids. I mean,
Yep.
Opioid overdoses, opioid use is on the rise in the suburbs, in the city. It is crazy.
Scary.
Can you tell a
Scary.
little bit about the opioid overdose and crisis that's going on and how that kind of ties into the adverse drug reactions?
That's a great question, man, and this is going to blow your mind and your audience's mind. You may recall last October, President Trump passed the National Emergency Act around the opioid epidemic and opioid
Right.
crises, right? And by the way, we're talking about prescribed opioids here. We're not talking about the illicit stuff, right? So let's make sure your audience is clear. We're talking about prescribed opioids,
Right.
and by the way, the number of deaths around prescribed opioids is around 60,000. I've heard several numbers, 58 to 64. Let's just call it 60,000 for a round number. So President Trump, pardon me?
Prescribed.
Prescribed. That's right.
Prescribed, not heroin in the streets, not the other, like, again,
not the illegal
drugs,
stuff,
but that
That's
people get a prescription for. And
thank you for emphasizing that. That's right. That's right. So 60,000 deaths a year because of prescribed opioid overdosing.
Mhm.
And therefore, President Trump passed the opioid national emergency last October. In fact, just about 30 days ago, he got $6 billion of funding to fight that. Now, if your audience heard the number I shared earlier, how many people are we losing every year because of adverse drug reactions? 125,000.
Right.
That's more than double. That's more than double the opioid overdosing from prescription medications.
Mm-hmm.
ADRs, adverse drug reactions, is 125, more than double, and yet no one's talking about it. And President Trump did not say anything about adverse drug reactions. You with me?
Right.
Right.
I'm with you. I'm following
It's crazy, man. It's crazy.
Right.
I'm pulling my hair out every day thinking, wait a minute, man. We're talking about the fourth leading cause of death,
you.
and no one's talking about it.
Right.
In fact, just Friday, 2 days ago, I'm really happy about this. We just actually sent out a letter to the president highlighting the fourth leading cause of death,
Right.
which is, again, more than double the number than the opioid deaths.
Right. Okay. Sorry, I was just turning up the mic. Some people were saying they couldn't hear me well. All right, so hopefully, yeah, that's better. But yes, so, and you're waiting for a response from 45, from President Trump, which is incredibly interesting and necessary. But you understand the politics, I'm sure, behind pharmacy and pharmaceuticals. I don't have to go
You're,
into
well, you bring up another great point, man, because our team, we started the company 5 years ago, and frankly, we had a lot of obstacles, man, from talking to doctors that didn't want to implement this brilliant test, and we just couldn't figure out. We're scratching our heads thinking, why in the world would you not want to use this test to better prescribe medications to your patients? And and by the way, there was hardly any media attention being given to this topic 5 years ago when I started the company. But I knew the time was going to come, man. I knew the time was going to come. And over the last, I'd say 12 months now, we're seeing a lot more media attention being given to this topic. A lot of articles coming out about now this brilliant test. And in fact, just last week or 2 weeks ago now, NPR, which I'm sure you know very well about
Very
NPR.
well, yes.
Okay. It's a huge, very well recognized publication as well that comes out. And they just came out with an article. And something our management team here at our company has known now for 5 years, but we just didn't want to say it without having some concrete backing. And here's what NPR wrote just a couple weeks ago, that the pharma companies had paid over, listen to this number, $9 billion to 900,000 doctors since 2013 to the present. Since 2013, yes, sir. Not my numbers. I'm citing it from the article. I'll send that article to you, man. You got to read this article.
Please do.
Okay?
Please do.
So it validated what we knew, but just couldn't say it because we didn't have that concrete evidence, and now we do. There's no rhyme or reason as we drill down into this test why every doctor should be using this test like yesterday. Period. Period.
Wow. So the test that you're talking about, give us a little bit more information about that. How did it get started? You said it's been around for 14 years. Your company's been around for 5. What's the story?
That's right. So the test was discovered actually by the U.S. government 14 years ago when they did the Genome Project, if you might remember that.
I do.
Okay.
I know a lot of nurses and doctors who worked on that project. And
That's
still
right.
Do,
so it was a big project, man. The government spent $3.4 billion on that project.
Right. I remember.
And during that project is where they discovered our genes that metabolize medications. And so that's when this test was born, was 14 years ago during the Genome Project. There's a few labs in the country now that do the actual testing of the diagnosis of this test. We have teamed up with the #1 lab in the country. It is the most comprehensive lab in the country, most comprehensive test, I should say, in the country. There are a few labs, and I don't want to get too much in the weeds here for your audience on this call, but there are labs that do 12, 14, 16 genes, 18 genes. Our lab does 53 genes, which is the most comprehensive test in the marketplace, Wesley. It's a 2-minute, let me just drill down if you don't mind. It's a 2-minute test that's given by the doctor, okay? It's a cheek swab, as you know, buccal swab. You got a Q-tip in your mouth. Okay, you got a Q-tip in your mouth, 1 minute on one side, another one on the other side, goes into our lab, and the lab sends back a report to your doctor that clearly shows, based on that individual's genetic makeup, that individual's metabolism. It will show the doctor what medications that patient can handle, and of course, more importantly, which medications they cannot handle. All right?
Okay.
It's a very clear, concise report for the doctor that we have put together. In fact, our report was put together by doctors for doctors. As we know, you guys are very busy. You don't have time to read complicated reports that come out. So we've dummied this report way down. So the first couple pages of the report, at a glance, the doctor can say, oh, this patient can't handle that or that or that. He's okay over here. Simple as that. Now they can prescribe the right medication, the right dosage, and right from the beginning, rather than playing the guessing game. With all due respect to the medical community, right now it's a guessing game.
Yeah, yeah. But one of the things that's important. So my physician partners, because I'm a psychologist, to put that out there. Yes, I mean, any practitioner is incredibly busy, and sometimes reading can be so difficult. And as sad as that is to say, to not just my audience, because a lot of the people who watch this are people who kind of follow me. It's sad to say, but we are incredibly busy. We're incredibly overwhelmed. There's a lot going on. So in terms of internal medicine, they're at an all-time high, like in demand, but in terms of like supply, like doctors who are practicing family medicine, there's some big gaps in terms of psychologists and lots of other practitioners. There's a huge gap. So yes, having it in digestible ways that we can get it quick and be able to treat patients is the best. So you've had doctors, physicians engaged and involved in making this report and making it easy for physicians who prescribe and nurse practitioners and physician's assistants to have this information.
That's right. The report is very simply done because we understand what you just said. The community is very busy today.
Right.
You guys are seeing more and more patients, making less and less money, unfortunately. We don't need to go there yet, but
right. Exactly.
and so we recognize how crazy busy you guys are, and that's why we dummied this thing down, man, so that you can at a glance. By the way, it's actually a huge time saver in the long run for the medical community. Think about this. My father must have gone back and forth to his doctor, I kid you not, probably at least a dozen or more times during that course of the year, okay? Now, every time my father went over there or called the doctor, so it wasn't just visiting the doctor, it was calling the doctor, say, hey, doc, man, I'm feeling like crap, what do I do? So the doctor's now got to pull out his file, read what's going on with him, read what he changed the meds. All that stuff is time wastage, okay? Beyond, of course, the patient not doing well with the medications prescribed. So this is actually a huge time saver for the medical community as well.
Right. So everybody's is concerned about healthcare costs. I know that I am. It seems like the cost of our health insurance is going up, and they're offering much less than they used to. I mean, I think my deductible before the insurance even pays is like $5,000. Right. How much does this cost? Is Medicare, Medicaid on board? Are they covering this, or is this out of people's pocket? How does this work?
Yeah, great question, man. So Medicare is covering the test. Wow. Of course, again, without getting into the weeds here, the doctor has to submit some letter of medical necessity, which is not a big deal. Most Medicare patients that are on meds have experienced some sort of reaction to medication, so it's a pretty easy qualifier for the doctor to send in. So with that, Medicare is reimbursing for this test. Medicaid is now also reimbursing in 12 states. And many insurance companies are now reimbursing for this test as well. When we started the company 5 years ago, there was hardly any insurance companies reimbursing for this test. And now more and more insurance companies are stepping up to reimburse for this test. So it's really gratifying. Wesley, in my opinion, man, today is what, July 22nd. You mark my words. You mark my words that within 2 years, I think this will be standard practice. I think you'll go into your doctor and they're going to say, hey, Wesley, man, we've had your urine test, we've had your blood test. Why haven't we had your test to avoid adverse reactions?
Right.
That's coming. It's absolutely coming. In fact, we believe that when the kid pops out of the oven, as they say, we
Right.
we think along with all the other tests that are given, we think that this is going to be a test that's going to be given because it's a one-time lifetime test. This is not something people need every day or every week or every month. It's a one-time lifetime test. All right, which is genius because now you know again what you can handle and what you can't handle. So what we've done, Wesley, is that we provide a letter to patients to take to their doctor. So your audience, without question, here's the reality, man. When we ask two questions of anybody, if you walk out your door today and you ask these two questions of anybody, hey, Mary, do you or anybody in your family take medication? Yes or no? What do you think the answer to that question is?
Yes, overwhelmingly.
Hey, with 4 billion prescriptions, as we talked about on the onset of the show here, right? So the answer to that question is almost 100% yes. Okay.
Right.
The second question we like to ask anybody and everyone is, have you or anybody in your family ever experienced a reaction to a medication? What do you think the answer to that question is?
Yes, or I don't know.
How about give me a percentage? How many percent do you think will answer yes to that second question?
90, at least 90%.
You're right on the money, man. You're right on the money. Anywhere from 85 to 90%, we get yes. The first question, 90 to 95% easily, right? Say yes. Do you or anybody in your family take medication? The answer is just about yes, 100% almost, right? And then, of course, the adverse reaction one is 85 to 90% easily. So what we've done here, without charging anybody any money to call that number that you just flashed up, we will provide them a letter. Again, let me emphasize, most everybody listening to the call here today needs this letter because you or somebody in your family is on medication, period, end of story.
Right.
So by calling us, we'll give you at no cost this one-page letter to take to your doctor, your next appointment, today, tomorrow, next week, next month, whenever your next appointment is, you're going to want to take this letter in. And you're going to say, hey, doc, as you know, I've been dealing with a lot of reactions with medications. I ran across this information. Any reason why I shouldn't get this test done by you? Right?
Right.
Now, frankly, you guys have only two options at that point. If I'm sitting next to you, Dr. Willis, and I give you that letter, man, you're going to either say yes or no to me, right?
Right. Yes.
Okay. Now, with all due respect, and this is my opinion, and we very much emphasize this point to the patient base out there, that if your doctor says no, and we hope they don't say no, but if they say no, with all due respect, go find another doctor.
Unless you come to see me and I say no. Just so you know. Unless they're in my practice. But I don't have a reason why I would say no.
That's right. Exactly. And I applaud you for that because, and I don't say that to be mean to the medical community in any way, shape, or form. I love doctors. I love the medical community. I got doctors in my family. I know a lot of doctors. You guys are amazing people, absolutely amazing people. But this is one area that I'm upset with the medical community, man. Been around for 14 years. It's got to be implemented like yesterday. Now, let me emphasize something. Although most doctors and most physicians, most medical groups, most hospitals don't know anything about this, I'm very, very pleased to tell you that the Mayo Clinic, Vanderbilt, Johns Hopkins, Stanford, many others are using this test today. In fact, let me just give a big shout out to St. Jude's Research Hospital. In fact, let me bow to them, if you will, because they have now made a commitment to test every patient with this brilliant test.
Wow.
Okay.
That is fantastic.
Hey, man, why in the world would any doctor, any physician, any MA, any PA, anybody in the medical world want to guess at giving medications? There's no reason for it when the genius of this test exists now for 14 years.
Right. Wow. Well, hey, geez. So, I mean, I try to keep this show at 30 minutes, Sunil. I know you're here as part of like a national campaign with Medix Prime. Talk to me how we can help you get the word out because more people really need to know about this.
I appreciate that, man. And, the best way is your audience needs to just give us a call, get that letter in the hands of anybody taking medication. I mean, anybody you're taking medications. And by the way, we're also expanding And if you're interested, any of your audience is interested in making some serious money and helping us, we've created a brilliant business model around this as well. So they can give us a call. We'll give them information not only on this life-saving test, but we'll also give them information, should they want, about how they can also join our company to help us with this market awareness campaign. It is really, it's so gratifying, Wesley, in closing the call here with you, man. It's so gratifying when we see the amazing responses. And if I have 30 seconds, let me share a quick story. Do I?
Yes, definitely. And I got some questions, by the way, just so
Oh,
you
good.
know. I got a couple of questions
Okay.
from the audience.
Great. Well, we do nightly webinars for our representatives. We got a national team of representatives that call in on doctors and call in on hospitals and so on. But we also have a two-pronged approach. We not only go after the medical community, but we're educating everybody in our general community, as I mentioned. My next door neighbor on the right, my next door neighbor on the left, my next door neighbor behind me, in front of me, and my family, friends, anybody and everyone. Why? Because everybody's on meds or they know somebody that's had a reaction, right? So
Right.
we do this nightly webinar, and we had a gentleman join us, and we do about a 20-minute call. They're clear, concise, only on this brilliance of this test. And at the end, we offer to give people this letter. Well, Kevin, the father, called in from Dallas, wanted this letter. We gave him the letter. He took it to his daughter's doctor. His daughter had been dealing with a medical problem for 15 years. And over the last couple of years, Wesley, she's been regressing, man, all right? So he takes this letter to his doctor, her doctor, and that doctor unfortunately said, nah, I don't believe in these tests. I've been practicing medicine for 35 years, so I know what my patients need and what my patients don't need. I was really disappointed to hear that response from that doctor. So Kevin, the father, took this information, this letter, to her other doctor. Now, Wesley, that doctor rightfully said, of course, let's get this test done. Why in the world would we not want more information about your daughter?
Right.
So long story short, man, the results come back. The second doctor says to Kevin, the father, here's what he said, man. He said, Kevin, I hate to say this to you, but I'm surprised that your daughter is still alive.
Yikes.
Because she's been on all the wrong medications and all the wrong dosage based on the results that have come back. So needless to say, that doctor adjusted her meds, and within 60 days, that young lady is like a brand new woman. In fact, we invited Kevin, the father. We do a national sales call for our sales reps around the country every Tuesday. We invited him, and he's literally crying on our call, saying, you guys don't understand what this 2-minute test did for my family. I got my daughter back. So these are the kinds of stories, man, we hear all the time.
Right. Wow. Well, I'm going to ask you this question first. So Keywood says, genomically, what communities are more predisposed to this concern?
Across the board. It has nothing to do with that. I mean, it's across the board. If, everybody's metabolism is different. And that's what this is really about. It's about how do you metabolize meds. And by the way, not to digress off that question, I forgot to mention, the FDA right now, the FDA has what is called a black box warning. I don't know if you're familiar with that by chance.
Yes.
It's called black box warning. I'm sure you are, right? There's 230 meds that are listed on that recommend this test be given before prescribing those meds.
Wow. Now, I didn't know that. That information I didn't know.
Right. So it has nothing to do with gender, race, or anything, man. It has everything to do with our metabolism, and that's what this test is testing for.
Okay. So like one of the things that we know, like say for instance, we know communities of color don't do well on ACE inhibitors. And that may be based on genetics and metabolism and different stuff like that. So I kind of get where that question comes from, Key.
Oh, it's a great question. It's a great question, but again, it doesn't matter. I mean, this is what this test is determining. Bottom line is what you personally, whether you're white, black, pink, yellow, it doesn't matter. What it's doing is testing for what your body can handle when it comes to medications.
Awesome. Well,
great question though, man.
Thanks so much, Sunil, for coming on and having the conversation about this. Please feel free to close it out. Let the audience know about any information that they need to know about you and the organization and how we can kind of nip this thing in the bud.
I appreciate that, man. Again, this is a message, not to be redundant, it's a message that everybody, anyone that is taking a medication or combination of medications must call us. Simple as that, so that we can give you this information. Again, let me emphasize, keep your credit cards in your pocket. When you call us, we don't want any money from you, okay? We get paid on the back end when the lab gets paid from the insurance and blah, blah, blah.
Awesome.
So we're not collecting any money from you guys, but we're going to educate the heck out of you guys so that you could save your life potentially with this information. And that's not an exaggeration. If I had another hour, I'd tell you all the stories of the unfortunate stories we've heard about.
And my
So
next
closing
hour
the
was
call,
on another podcast, by the way.
there you go, right? But call that number, 800-989-7703, 800-989-7703. You'll hear a recording, a little bit more details. We'll get your information. We'll email it to you. We'll be able to answer any questions that you might have. We're totally transparent. There's no cost for calling us for this test, period.
Awesome. Well, thank you again, Sunil. Have a great night, and I will hopefully get to talk with you later.
Thanks, man. Thanks for having me. Appreciate it.
Thanks. All right, guys. So you all have heard it. Thanks, Sunil, for coming on. I apologize for keeping you all a little bit later than I'm used to. Next week's show is going to be incredibly amazing. I have on one of the top, she's not a sex therapist, but she specializes in sexual health. A lot of my viewers and a lot of people who come into my practice say, hey, doc, this is one thing that's not working in my relationship. And I always talk about it candidly. There are three things that it could be: sex, money, and communication. When it's one of those three things, you're going to have to work hard. So she's going to be in talking about sexual health, particularly sexual health as it relates to asking for things that you need, also protection of yourself, whether it be with a partner, whether it be with a bae, whether it be with boo, and how we can do that better. Guys, I don't want to have any type of kind of like hang-ups about sex. I want everybody to know and be on the same page. So I look forward to seeing you next week. Have a great week, my beautiful people. I love you, and I'll see you then.